cmpradio.net, the voice of Chester.
And so I think it's important that you understand the clinical trial process. I'm not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction about how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated or just people in general?
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do. Hey, welcome to Keeping It 100, where we have these open and honest conversations that make sure that you have the health information you need to make good health decisions. I am your host, Dr. Kristin Motley, and I am joined by my lovely co-host, the street practitioner himself, Georgie Mink Jr.
Good afternoon, Doc. How you doing?
I'm good.
What's going on, everybody? How y'all doing?
The award-winning Georgie Mink Jr.
Oh, yeah. And I usually have the
forget.
award. But you know what happened to the award at homecoming.
It's coming back. The award is coming back.
Yeah.
It needed a little rehab.
The wind blew it, and it broke. And my heart was broke.
George was really upset.
Yo, at homecoming at that, P.
He was really
I looked at that award like, what happened?
He
But
took it
it's
personal.
Okay. It's all right.
I was like, George.
I think Ebony did it.
Ebony ain't do it.
Okay. All right.
It was the wind. It was windy out there.
All right. Okay. Because I was looking at Ebony like, come on, man. What happened?
You was real mad.
Yeah.
It's the award is going to be rewarded with some glue, and it's gonna be all right.
Okay. Well, you know, you're the fixer-upper.
We'll
so
have it back. We'll have it back. But what you been up to? I know you're dealing with a loss in your family.
Yeah. Peace.
Really sorry.
Rest in peace to my mother-in-law, Arlene Big Lynn. Tough one. You know, tough one. She was called. And so I'm dealing with a grief situation.
I know. That's
know.
never hard. I mean, that's never easy to go through.
Prayers for my wife and the family and everybody and just anybody that know her. She touched a lot of lives. I mean, I learned a lot, like being older now, is like it's all about legacy. So, you know, when you start getting into what, you know, when you finally leave here, what's left. So she has a strong support. She was a good woman. You could just see it in all the people that loved her. So that's kind of how I want to leave.
That's good.
Yeah.
Legacy.
Yeah.
Legacy. What's your legacy going to be, Mr.
Legacy. Just Mr. Bro, man. Just always here when you need him. Always showing up. And the last man on the floor.
There you go.
Yeah.
Let me find out you cutting the rug.
Hey.
Oh, yeah. So my prayers have definitely been with your family over the last couple
Trace
weeks.
been talking like, who that on the phone? The doc? My doc? Like, who the?
I had to, you know.
I appreciate it, though, Doc. I appreciate it. It means a lot, though.
Yeah, of course. All the support that you need during this time. So.
Thank you.
Now, on to you and your personal matters. You have a doctor's appointment. Not that personal.
Right. No, I'm just saying.
Why you make that face?
Because I need you to start talking about doctor's appointments.
You got a doctor's appointment coming up.
Yes, ma'am.
What day is it?
I don't know.
It's like October 30th or the 31st.
I think it's the 30th because I think it was the day before Halloween. Yup.
I need you to make sure.
Okay, I am.
Check and confirm.
I am, Doc.
Gee,
I still have time. I'm not playing. It's not even nowhere near the 30th.
Yes, it is.
Okay.
It is close to the 30th.
Doc, I'm going.
It's less than 2 weeks away.
Doc, I'm going.
But you don't even know what day it is.
Doc, there's no way I can't find out after this.
All right. So you're going to the doctors. You're going to the doctors.
Yes.
Get your blood pressure checked.
Yes.
Get all your refills.
Yes.
Make sure you're good.
Seriously, because that's how I want to go into the new year anyway.
Yo, you are so funny.
What?
You just be talking.
What?
George, I'm not even going to let you just play me like that.
It sounds good, though, don't it?
It sounds good, but that's what you do.
I mean it,
you
though,
make
Doc.
it sound
No,
real
I mean
good.
it. I'm just saying it too smooth for you, that's why. But no, I'm serious. I'm serious, though, Doc, because, I mean, we are preaching healthy habits and healthy lifestyles, and we have to lead by example. That's not written speech, even. I'm telling you, I'm serious. No, I'm serious,
I
Doc.
can't with him, y'all. He just be gassing me up.
I would never
Smooth
do that.
talk.
I have a real appointment. I made it on the air last time.
You did.
Okay, come on, Doc. Give me some credit.
All right. So I want to pat myself on the back because we have been talking about this cavity that I have and me being scared to get a needle in my mouth, and I want to go get my cavity filled. Well, I got my cavity filled on Monday.
Wow. Okay.
I got my cavity filled Monday, and I did not feel the needle at all.
See?
I don't know what happened, but I just didn't feel it. And I just thank God that he is so good to me that he was just like, girl, stop playing.
Right.
I'm going to show you what I'm going to do.
Right.
I did not feel that needle go in my mouth. So I had my first 2 cavities filled. I'm feeling okay, and I don't want to have any more. So I need to start flossing.
Right, Doc.
I don't floss, but I need to start flossing. I don't know how or when I'm going to fit that into my daily routine, but I need to do it.
Right.
I'm not trying to be back up in the dentist seat. Have you been to the dentist?
Oh, Doc. Could we get through the first appointment first?
All right. So you're going to go see your PCP.
Dentist after that. Y'all
and while you there, before you leave, what can you do?
I can make the dentist appointment.
Make it
just get the checkup and the pictures and all that stuff. They still hold your mouth with the film like that?
Mine do. But there are some
that's
different
also
places
old
that
school.
don't. It is old school, and it is annoying.
Yes.
It is annoying, but
I don't like
that's
that.
how I got the cavity found. So we got that stopped up. Now I won't have to get a root canal and all the other things. I'll be walking around here looking like yuck mouth.
Right. No,
so
we can't have that.
You got to make sure you schedule your dentist appointment next. It's all in one place.
You're right. You're right.
It's convenient for you. All right. What else? So I had surgery on my thumb too.
Yeah. See, we on real
I've
lifetime.
just been doing.
Over
This is
here.
why we haven't had the show in a couple of weeks. I'm trying to get my life together. So I had a tumor that was growing in my thumb for a long time. Last year, I went to the doctor to see about it. They did an MRI. They said it was giant cell carcinoma is the name of the tumor it is. And I was supposed to get it removed last summer. And then something happened. I had to cancel my appointment. And you know what I do. Life be lifing. And then we don't do something until something happened. I woke up one morning and like my whole hand was numb. And I was like, good Lord, let me call this surgeon and get back on these books and get this tumor out of my hand. So I ended up calling, had it scheduled, and last week I got the tumor out of my thumb. And so this is what you see here. So I get the stitches removed on Monday. Wow. I took off this wrap and it looked a little sketchy. So I'm hoping it's healing okay. We're going to find out on Monday. It doesn't hurt anymore. It just look a little special. Might have to have the doc take a look at it before she leave.
Okay.
So that's where I am. But we have been in these streets.
Yeah.
We have been in these streets. We did homecoming.
Shout out to everybody in homecoming.
Homecoming was legendary. The win was legendary. The high won, which is always good.
Yeah.
And we did a vaccine clinic.
And we won. Like we smashed them bulls. I don't even think they scored.
Yeah, that's how we roll. That's how S6 rolls. But yeah, so we did a vaccine clinic. We did COVID and flu shots, which was really nice. I wasn't really expecting a lot of people to get vaccinated because I didn't have time to do a lot of promotion. But we did about 10 to 12 vaccines that day. So that made me feel better that we did have people that did participate. So that was nice. Francis was in Upper Darby holding it down for us at Senator Kearney and Gina Curry's community baby shower event. So that was really nice. They had a good turnout out in Upper Darby for that. That was good. And we have our own huge event coming up very soon. The Healthier You Conference. So this is a conference I started over 5 years ago. I just haven't done it in the last 3 years because of COVID. But this is a very, very nice professional event, bringing out people to just learn what they need to learn and make better health decisions. So we're bringing out physicians and dietitians and therapists, health coaches and scientists, and just a day full of amazing Black excellence to come through to teach our people what they need to know to prevent health problems. So this is for people who want to prevent from having diabetes and prevent themselves from having high blood pressure and prevent strokes and heart attacks and all the diseases. How can we make changes in our lives now to prevent these diseases? And if we had the diseases, how can we manage them better so that we can come off of some of these medications and just live our lives to the fullest? So I handpicked all the speakers. I handpicked everyone that's involved to really come out to educate our community. And I'm excited that I'm finally able to have it in Chester, because for the last few years, I wasn't able to get sponsors to pay for me to have an event in Chester. So I had to have it in Philly, I had it in Newman. And so I'm very grateful for the sponsors. Shout out to Local 413, shout out to the Black Equity Coalition and all the others who have provided the funding for me to have this event and to make it free to the public. And so really proud and excited. That's coming up November 11th. So make sure y'all register. You got to register. You can't just show up at the door because we're ordering food. So don't just show up. You got to register in advance. You can register at healtheducatedinc.org. Click the registration and make sure you sign up and get your name on the list. It's going to be a nice day. I'm looking forward to it.
Yeah, I can't wait. I think I'm going to wear like a lab coat.
All right.
Yeah, get
Full
street
costume.
practitioner on there.
Full street
I think I'm
practitioner
gonna wear a lab
costume.
coat.
And for the fellas, because for me, especially with getting Local 413 involved, I really want the men, black men, to really come through and take advantage of what the conference has to offer. I have a full track that is dedicated to the black man. So we have a group of physicians that are coming in. We have some therapists that are coming in. They're all black males. They are coming to give you what they know to help you live your life just a little bit better. So come through. Come through for sure.
Yeah, come on through.
It's going to be nice. So what is happening in the news? Well, we know we have a new COVID vaccine that's available. We have the updated COVID vaccine. So want to make sure that everyone knows that. Make sure you are staying up to date. If it has been at least a year since your last dose of a COVID vaccine, get the new COVID vaccine. If you have never gotten one, it's not too late to get one now. We know that COVID cases are on the rise, they're going up, but people aren't as sick as they were when this all started because a lot of people have had COVID or they have had the vaccine. But people are still getting sick and it's still spreading. So the best thing to do to protect yourself is to make sure you stay up to date on the vaccines. The good thing is that the flu shots are available too, and it's great that you can get them both at the same time. You can do COVID and flu at the same time. It's not a problem. So consider doing that. It's convenient. You don't have to come back. You just get it done in one day and knock it out.
Yeah.
So everybody, please just stay safe. The holidays are coming up. This is a good time to get yourself protected.
Quick question though, Doc. Somebody asked me, is there still places that do it for free?
That's a really good question. So right now, I don't know. I think if you go to a place like Chest Pen, you might be able to get it for free. If you go to a pharmacy, you're not going to be able to get it for free unless you have insurance. So people that have health insurance can get it without paying out of pocket as long as your insurance company covers the COVID vaccine. People who don't have health insurance, I know the state was putting a program together to confirm that you don't have health insurance and to allow the pharmacies to give you the vaccine, but that's only for certain pharmacies. So it's not as easy as it was when the COVID vaccines were covered by the government, and it's really unfortunate and disgusting that that it's harder to get prevention. It does not make any sense to me. It should be easy for someone who does not have insurance to go to a pharmacy, like a person that does have insurance can go in and get the vaccine and not have to worry about it. If you are paying out of pocket for it, I know places are charging as much as $150.
Wow.
Nobody is going to pay out of pocket $150 to get the COVID vaccine. They halfway don't want it anyway. So then you put up all these other barriers, and then you wonder why people are not vaccinated.
Right, and I feel like they should have still covered it.
I don't know why they wouldn't, but
however it came to the United States, I know they're trying to make money now, but I'm just saying they still should have covered it for at least 5 to 10 years.
I think so the way that America is set up in terms of commercializing healthcare in every way that they can, we knew that it was going to become a time where
we warned them,
the vaccines were not going to be covered by the government. And although I don't agree with that, it's okay. But what they should have done in the meantime was create a pathway for people that don't have insurance to get the vaccine as easy as people who do have insurance. Because there are people that are walking away from the pharmacy because they are not going to pay for it.
Right.
And that should not be the case
Right.
in the great US of A. And so they should have had these programs in place to make sure that people that don't have insurance can go to a pharmacy just as easy as someone else to get the vaccine. And then everybody can still make their money, but it should be more planning and intention put around people who don't have the resources to get the healthcare services that they need.
Right.
So call Chest Pen. They may be able to offer it for free. But other than that, I don't know where to tell people to go right now that don't have insurance until the state gets all of their coverage connections set up through the special pharmacies that will be able to offer it. Oh, they could probably go to the health department. Yeah, the Delaware County Health Department. I'm sure they will offer it for free.
Okay.
So they have a site in Chester. They have a site in Yaton. So look up the Delaware County Health Department if you're in this area. If you're not in this area, you can go to any health department in your area, and they should be able to offer you the COVID vaccine at no charge. I forgot about that.
Okay.
I had to ramble a little bit to get my gears grinding. All right. Any other questions come up about
That was a
COVID?
big one.
All right. All right. Good. So as we know, October is Breast Cancer Awareness Month, and I found out something that I didn't know about breast cancer, and that is that Bud from The Cosby Show, he had breast cancer.
Wow.
He was diagnosed at a young age too. I think it was in his 30s or 40s when he was diagnosed. He also had colon cancer.
Right. I see.
So he fought both of those. He had colon cancer. He was treated for it. It went away, and then it came back. And he says now that he wished he would have gotten his colon cancer screening done.
Wow.
And we were talking about that recently. It's so important because colon cancer grows so slow that if you just get your screenings done every 10 years like you're supposed to, you can catch it before it turns to cancer. You can catch the growths before they turn to cancer. But if you don't get the screenings done, you don't find out until you have cancer, and then you got to go through this whole thing.
Right.
And so the screenings are so incredibly important. When you are 40 years old, you should be talking to your doctor about all the screenings you need to start getting and start looking at too, because it's so critically important. So we talked about him having breast cancer, and I'm finding out that it is definitely a thing in men.
Wow.
And so we want to welcome Dr. June Messam to the show. She is no stranger to the show. She came on, she talked about childhood trauma because she is one of the only pediatric trauma specialists in the state and a very few in the whole entire country. But today she is coming on to share her personal story and her journey as a breast cancer survivor. So welcome back to the show, Dr. Messam.
Thank you so much for having me.
You're welcome. You're welcome. So I just kind of picking up on Bud and his story.
Yes.
Could you share what you have, what you know about how common it is for men to get breast cancer?
So about 1% of all cases of breast cancer happen in men.
Oh, wow.
So it's not that high of a number
Yes,
when you
ma'am.
compare it to women. But the truth of the matter is we don't hear very much in the news about that men need to be also screened. And the problem is because it's so uncommon in men, it typically is found at an advanced stage. And so then that is what makes it more difficult to treat. And with any kind of disease, the earlier you catch it, the better the outcome.
Yeah.
And so if you're feeling something on your chest that shouldn't be there, that is different than before, please don't feel silly. People don't want to ask their doctors about things. Go ahead and ask. It can save your life.
So men should be looking for a lump too.
Yes, exactly. It's exactly the same. They have ducts under the nipples just like we do. One of the most common kinds of breast cancer is intraductal cancer. And so they have the same. So the earlier, again, the better.
Wow.
Is there any recommendation on how often they should check? Like for women, we should check at least once a month. Is there any type of recommendation for men?
There is no recommendation for men, actually. So if you just do it, like when you're taking a shower, you have to soap your body, right? Clue in and see. If you just like you have, I'm sorry to hear about the growth on your finger, but you had something. Do not do what Dr. Motley did and ignore it for a year.
Wait for a whole year.
Do not do it. It is dangerous. This is cancer. Cancer cells grow. And so you, just same way you had it on your finger, you can get it anywhere in your body. You do not have a lump in your body and don't check it out.
Yeah. Right. All right, fellas, so you heard that. Pierre, you better be listening. Check your chest for lumps.
Absolutely.
My chest every night.
There you go.
Oh, really?
All right, good.
You touch on me?
Yes. Fill them up.
And actually, your partner might be the first one to feel it. So
Oh, right. Okay.
don't ignore it if someone finds a lump on you.
Yep.
Okay.
Right?
Thanks, Dr. Messon.
You're welcome. And I wanted to just say, you made the recommendation that we check ourselves even as women once a month, right? I used to tell people, pick the beginning of the month or the end of the month, and you want to know what your breast feels like at that time. Because if you're younger and you check your breast every day, it feels lumpy, bumpy before you get your period, right?
Yeah.
So I tell them once a month, and now that's not even the recommendation.
I heard they stopped that.
Yes.
Wow.
Yeah, they stopped that.
But I'm going to tell you to keep doing it, because that is the thing that made me find my tumor.
It's crazy because a lot of the women that I know who have had breast cancer, they found it on their own.
Yes.
They found it on their own. So it was shocking for the American Cancer Society to pull back on that recommendation to check your breast. And I'm going to just leave it at that.
Yeah, I completely agree with you, because I'm a physician, right? But we each specialize in our own thing. And in the birth to 21 to 24 years old, breast cancer is not that common, right? So I literally did not know you could have breast cancer and it'd be missed on a mammogram. I had 3 negative mammograms at the time I had breast cancer.
Wow.
So if you're feeling something and it ought not be there, it wasn't there before, do not be reassured if they say on your results that you have dense breasts. If you have dense breasts, they're having trouble seeing it.
Yeah.
And depending on who is reading it and their experience level, they could completely miss it.
Wow.
So you are saying you had a lump. You could feel a lump, but when they looked at the mammogram, it came back negative.
Yes.
So if another person would have read the mammogram, could they have picked out the lump? Like, was it?
My breast surgeon did, and so she changed where I'm getting my mammograms.
She's looked at the same mammogram
She
and
did.
saw it.
When you go to do surgery, when you're diagnosed with breast cancer, whomever is going to perform the surgery, they literally want every single image that they can have, and they want everything, right? And I'm sure that sometimes in people who are not black or brown, that breast cancer is also missed. But I always worry that when I walk in the door, no one knows that I'm a doctor.
Yeah.
And I am treated differently.
Mm-hmm.
Right? So, but I have wonderful doctors, and I am so blessed and feel so thrilled with the care that I received. But the fact is that it was missed on my mammogram.
Wow.
But 3 mammograms, though. 3 different times?
It was 3 different times. The first time, listen, I'm a big gardener, and I spasm muscles all the time. And so I just thought, I was so relieved. I'm like, it's a spasm. It's a muscle spasm. It's okay. I'll stretch it out. And I kept doing my thing. And then generally breast cancer is asymptomatic in the early stages, right? You don't know you have anything. You feel great. You're doing wonderfully. I was living my best life. But I love to lay on my right side and cuddle with my husband at the end of the night, at the end of the day. And what started happening was that I started having pain. And it was actually growing out of the milk duct, probably, what caused the pain. So I still was reassured by that mammogram.
Yeah, of course.
And so I was doing a CME, a continuing medical education class, about ways that your breast might change when you have breast cancer. Didn't think a thing about it because I had a spasm muscle. I then went to take my shower to get ready for work and looked in the mirror, and I swear I saw what was on that,
Wow.
the images, and I thought, oh my gosh, I'm losing my mind. I'm tired. I need rest.
Right.
I walked out, calmed myself down, walked back in, and then there it was. There was no mistaking it. I put on my robe, ran downstairs to my husband and said, I have breast cancer. He was like, sure.
Oh my
Why
goodness.
don't you call your doctor?
Right.
And so I went to my doctor, and I have to tell you that I was not good about going to my doctor. I just really wasn't. If there was a problem,
Because of time, like you just didn't have time,
I'm
or you
always
didn't.
working.
Yeah, I know.
I'm
Right.
always working. Oh my goodness.
Mm-hmm.
But I went this time and I said, I wonder if we could discuss a differential diagnosis about lumps in my age,
Mm-hmm.
range and stuff. And he said, lumps? Let's take a look. And he was very kind, but he would not discuss a differential diagnosis. I had already checked. I know at my age, wasn't going to get those benign cysts and all of that. So he scheduled what's called a diagnostic mammogram. So you get the mammogram, and then right after they do the ultrasound, and then a biopsy later. And so it was within a month I knew I had breast cancer.
Wow.
What stage was it?
I was stage 1, like right on the
Oh,
border of
okay.
1 to 2. So I
That's
still,
great.
but because of where it was very visible. It was very low in the breast. It was an unusual location. And I think that that's why they didn't see it. And it's more common on the upper outer location.
Gotcha.
And so even on the day that I knew I had breast cancer, even before that ultrasound, they have you put a little marker on the tumor, and then they find it on the mammogram, and they couldn't find it on the mammogram.
Wow.
Yeah.
Oh wow. So they
So
really
we
couldn't find
They
it.
really couldn't find it. It was more location than anything else. So the ultrasound picked it up.
Wow.
Wow. So when should women start getting start getting their mammograms done?
So the recommendation is at 40 years old, right? But in families where there's high risk, you get a mammogram when anything is abnormal, right? So we ended up having a cancer gene. And so my children are at risk.
Yeah.
And so the minute they feel anything, we're going to get ultrasounds and mammograms. The reason they don't want to do a mammogram in the younger ages is because the breast tissue is dense. Now, your breast tissue can be dense at any age, right? But definitely it's dense at a younger age, and it's harder to see a small tumor.
Okay.
I was persistent because my cousin had just died from breast cancer, metastatic breast cancer. Yeah, and so I'm 8 years cancer free. So I'm
Whoop,
good.
whoop.
Yeah.
Yes.
I celebrate. It's life changing, and I celebrate every year.
You should.
Yeah.
You should. Now, since you were diagnosed with breast cancer and you have daughters,
Yes.
at what age is there an specific age that they
No, it's the
should start
same,
getting,
It's the same.
or just wait until they feel something and then be on high alert?
It's the same 40.
Oh,
But
okay.
I'm going to teach them to do good breast exams because of the cancer gene. So much is changing by the moment. So they have pieces of my tumor. I sign up for every study there is at the Hospital of University of Pennsylvania. That's where I get my cancer care, and they're doing so much research with the hope that they would be able to find something to target my specific type of breast cancer.
Good.
Oh, wow.
Thank you
Nice.
for contributing to the pool of research.
Right,
I mean,
right.
that's a whole nother show because
Yeah.
we don't like
Yeah.
we don't like research. We don't like you taking our stuff and looking into it and doing anything because we don't trust. So that's a whole nother show that we can have.
I I'm like, you want me to sign? I'm signed. The only thing I had to finally put a stop to is the amount of blood they were taking from me every time. Because I said yes, and they just kept taking blood every visit. And finally said, no more blood, but you can use the tumor for whatever. Look, my husband is a researcher. He has a PhD from the University of Pennsylvania.
Nice.
And so he does oncology, he works in the oncology department at Merck.
Yeah.
And so it was my husband that helped me put my cancer team together.
Nice.
Wow.
That is a blessing and a privilege, and that's awesome. Now we know that Black women have a higher chance of dying from breast cancer than white women. Why is that?
Because we don't go in for care.
That's part
They
of it,
do
right?
like us. We're busy. We're
Yeah.
busy working. We're busy with life. And by the time our tumors are discovered, it's in an advanced stage.
It's late, so it's
Yes.
missing the mammograms.
Yeah. I can't only say missing the mammograms because I didn't miss the mammogram.
Yes, true. That's
Right?
true.
Right. So it's a combination of things. I think because I'm a physician, I kept checking because I wanted that thing to go away. But I think of it all the time and think about if my sisters had checked and they found something and they had a negative mammogram, they may not have gone any further.
Yeah, I wouldn't have. I'm like,
No,
I don't
once
think my
you got it
mammogram
checked.
is negative.
Yeah.
I'm
Once you get
good.
it checked, that's what you go get it checked for.
Yeah,
Yes.
exactly. Well, I'm not gonna second guess
Right,
it.
right.
Yes. So I'm going to say, as a woman, and not even just a Black woman, but definitely for Black women, you want to make sure you're checking your breast once a month. Choose the beginning of the month or the end of the month. And if you feel something in your breast that wasn't there before, you need to get it checked. Sometimes if you're large-breasted, you might not feel it in your breast, but you may feel the lymph nodes under your armpit getting larger. If you feel that, same for men,
Right.
you make sure you get it checked.
Is it a certain way though that you try to do it like without like going all the way into the details? But I'm saying like a certain way to check.
You can go
just
into the
rub
Let's
it.
details.
go into the details.
No, I'm
This
just
is
saying
keeping
you
it
just
100.
rubbing, squeezing. What we doing?
So you don't squeeze anything.
Okay.
If you squeeze it, the only thing, if you check your nipple, you squeeze your nipple and milk comes out, and you're not a
Not me.
lactating mom.
Yeah.
Even for men with breast cancer, you can have that happen. Absolutely.
Because you have milk ducts.
Yes, you have
Wow.
milk ducts. That's how come you can get breast cancer.
Okay.
So literally, you just want to have overlapping strokes so you don't leave out any part of your breast tissue.
Right.
You
Wow.
just, and I was taught one way to go in circular motions. My breast surgeon, who is fierce, she just went one hand up and down, crisscrossing all the way around my breast. Immediately felt it.
Wow.
Oh wow,
Yeah,
Wow.
there's nothing like experience.
Right.
that's good. Crisscross,
Yeah.
one down motion,
Yes.
cross cross over.
Yes. You want to make sure that you do it in a way that you don't miss any spot on your breast. And that if you put your hands on your hips and tense the muscles, with breast cancer, it will change the shape of your breast.
Oh wow.
Yes, so you want to look at it in a mirror. You
Yeah,
can be
I
a little
remember.
bit asymmetric. You don't want to see any dimples. You don't want to see any changes in the skin. And you for sure don't want to see any tumor.
No
Right.
discharge.
Right.
No discharge again unless
Unless you're lactating.
unless you're breastfeeding. You don't want any.
Right.
So a part of the reason that Black women die at higher rates are because we're not catching it early enough.
Yes.
I imagine another part of the reason is because we don't have the same access to care and
Yes.
all the structural barriers that are in place that prevent us from getting good quality care
Absolutely.
as well.
Absolutely. And more as physicians, I'm an independent physician, so I can spend more time with my patients. But sometimes I go to the doctor and I'm like, okay, I didn't even get to take a deep breath. And you're done checking my lungs.
Right.
Wow.
Right.
Right?
Right.
Yeah, yeah.
That's true.
Honestly,
It is true.
listen, you go to a specialist and they put that, okay, I listen to your heart. Okay, that was 5 seconds
Yeah.
tops. You didn't hear anything.
Yeah.
Right? But with the constraints with insurance companies, with what they want us to do, people rush through. So it's, yes, it's definitely a problem with the quality of care that we're receiving. because of the time constraints that are put on doctors.
Yeah, so to me, it sounds like we definitely need to advocate for ourselves
Yes.
beyond the mammogram even.
Yes,
I mean, for
yes.
your story, 3 mammograms were negative.
Right.
Yeah.
And you
That's-
still
that's
had breast
terrible.
cancer. Like,
Yeah.
that is insane.
Yeah,
So I'm glad you're talking about that.
Yes, it's really important. I mean, I think of all the things that shocked me. So if you're a very stressed person, if you're obese, if you have any risk factors to get breast cancer, just put you in a stressful situation and boom, those cells love it, right?
Yeah.
My job is high stress every single day. And so I was at risk. I knew that I was at risk. And I was very reassured by the negative mammograms. I really was, and thought
Yeah.
afterwards that I was safe, I was okay, right? And so the fact that as a physician, that can happen, and the CME, as much as I detest doing those tests, it saved my life.
Wow.
That's a good story.
Thank you for sharing that. Now, talk us a little bit about your treatment path. Did you have it removed, or did you go on chemo or radiation or something else?
So it really depends. So I chose to have a mastectomy.
Okay.
Because my cousin had just died.
Yeah.
And I'm originally from Guyana, and I have a huge family. And I knew that family members were dying from tumors. But in our country, we didn't really have doctors, so you didn't know.
Wow.
Right? So
Wow.
my mom said, remove both. So that was my first choice, to have the double mastectomy. But then I would have had to wait another month, and my anxiety did not allow me to do that. I'm like, okay, I can come back and
Yeah.
remove that.
Yeah.
Just rip it out, take it out. I was the happiest person on the day of my mastectomy.
Yeah.
I had no sadness, no fear. I just prayed that they would get every single piece
All the
of
tissue.
that cancer.
Yeah.
Yes.
Right.
So they, when you are diagnosed, then you go from the mammogram, the ultrasound, then they start doing MRIs. I continue to have dense breasts after, so I get one MRI per year, one mammogram per year. And now they do these 3D mammograms, which is so much better. So it's not the 2D stuff that I
Okay.
was having
Okay.
at the time that I did it.
Okay, well, so do you think that the 3D mammogram would have caught the breast cancer that you
I
had?
hope so.
Yeah.
I surely hope
So
so.
should we be requesting 3D mammograms?
Well, I think they only do the 3D mammograms now.
Oh, they only do them now?
Yes.
Oh, okay. Okay,
Yes.
good.
Yes, they've recently changed.
So everyone's doing that now?
I think everyone
Okay.
is doing now.
I feel
so
a
that
little better.
increases it.
All
Yeah,
right.
yeah, I think that.
I won't have to put up no fight. with
Yeah,
my
because I
doc-
was going to ask you, do you trust the system now? I mean,
yeah.
you know, like mentally, just like you said, like if it's anybody else who's not a doctor, they're going to feel comfortable with the results.
Yeah.
Me.
Yeah.
So how can you trust going to the doctors now if they, knowing that it could be a misdiagnosis?
Yeah. So I have to tell you that I still have anxiety over it.
Right.
Because we're human, right? We're human and we're stressed, and
Right.
sometimes we might miss something. But I think you have to trust your doctor.
Right.
The team that I have is so awesome. And when they're thorough and they discuss it with me, they discuss it with my husband. And so I think that the first and foremost, you have to trust your provider. And if you don't trust your provider, you need a new provider.
Get a new one.
Yes, you do. Because if I don't trust the person that I'm putting my life in,
Yeah.
my life is in your hands, for
true.
God's sake.
That's true.
If I don't trust you, I'm sorry, I'm not coming to you.
Right.
And I tell my patients the same thing.
Right.
If you don't trust me, you don't believe that I'm taking the best care of your child, there's so many other doctors I can refer you.
Yeah.
You can go. You don't go to someone who don't trust you, or if you're not feeling listened to.
Yeah.
That being said, there's some hypochondriacs.
Yeah.
Oh my gosh, every
Definitely.
little thing, they think they have cancer.
Yeah.
I have a cricking in my neck. When did it start? Last night.
And I slept on the couch.
Right.
Yeah.
And I slept on the couch.
That's not cancer.
Right,
That's
then
typically not how cancer
Right,
presents.
right.
So they're going to be that off liar, hypochondriac. But for the most part,
Mm-hmm.
we're reasonable, busy people, and we just don't have a lot of time.
Yeah. It's true. It's true. I want to give a shout out to the audience. I know we have a live studio audience here today. In case y'all was wondering, we are live and in living color over here. And I also want to give a shout out to Queen Lean. I see Queen Lean in the chat. Abdul
Queen
in the chat.
Lean,
My
Queen
vision
Lean.
ain't that great, but I can see a couple of y'all hollering at us and giving us a shout out and
Queen
adding
Lean.
your 2 cents. So thank y'all for doing that.
What's going on, good brother?
But Dr. Messon, the last thing I wanted to ask you today is what do you want women and men to know about breast cancer that people just don't know, they don't quite understand? Like, what is the thing that you don't want anyone to walk away from here not knowing?
I want you to know that you could have breast cancer and not feel any pain and feel totally well.
Wow.
I want you to know that. Because the biggest shock and the biggest thing that my husband and I had trouble understanding was I was doing really well.
Yeah.
I didn't have, I wheeze once in a blue moon when I get a respiratory illness. I do have allergies. That's like no big deal.
Right.
I had no idea that I could have cancer. I could have a tumor growing in me and be living my best life.
That will blow your mind.
Yes.
It's like, I'm doing all the right things. I'm doing all the right things.
Yes.
How?
Yes.
Yeah, that'll blow your mind. Well, thank you so much for coming on the show today.
Welcome.
Thank you
Oh,
for
you're
sharing
so
your story and
welcome.
being so open and so honest. And I know that there are so many things you said that have helped the audience, that have helped me. I'm getting a second opinion on all my mammograms. All of them. I need somebody else to take a look at it just to make sure, because that is insane. So thank you for sharing
You're
that
so
today.
welcome.
Thank you for sharing
Thank you
that
for
today.
having
Of
me,
course,
as always.
of course. So, on that note, I want to remind you all that we have this amazing health conference coming up, the Healthier You Conference. And I have a friend that has spoken at the conference every year that I have had it. She flies in from Atlanta. She is a PhD. She's a scientist. She does a lot of research on cancer, oncology. And she comes and does a talk on how to prevent, how to limit your risk of cancers. So you may not be able to prevent it because of genetics or family history or whatever, but she talks about what the research has shows on how to decrease your risk of cancer, what foods you should be eating, what foods you should be staying away from, what activities you should be engaging in. It's a really good talk. That's Dr. D. Grace. She's amazing. So she'll be here. She's flying in from Atlanta for the conference. She wants to make sure that my people know what's going on, because it's not going to be a TV show about it. She wants to make sure that people get the real word that they may not hear in their conversations with their friends and family. They may not pick up a book about it, but she's going to make sure that before you leave her session, you know exactly what to do. Now, you might not do it, but you can't say nobody told you. You cannot say nobody
Why you
told
look over
you.
here, Doc?
Listen, I could have put up a mirror
Right.
and been looking at myself.
Right, and I'd have been looking straight.
So I'm just looking at you because you're my co-host.
Nah,
I
I
need
know,
somebody
Doc.
to look
And I
at.
know you care, Doc. It's okay. I know where it's coming from.
Yeah, so make sure you check out the Healthier You Conference. You can get your tickets. It's free at healtheducatedinc.org. Just register. You have to register in advance. It's going to be a really, really good day. So that's it for us today. Thanks for tuning in. I hope this was helpful. Check us out next Thursday at 4:30 right here on cmpradio.net. It's
All right,
the
everybody.
station. And so I think it's
Go.
important that you understand the clinical trial process. I'm not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction about how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated, or just people in general?
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do.
cmpradio.net. The